Are you thinking about becoming a licensed mental health therapist? Well, let's break down exactly how to do it because there are multiple routes you can take in order to achieve that goal. Hi, my name is Shan. I'm a licensed mental health therapist, private practice owner, and digital creator. If you are new here, like I always say, come on in, come on in. Make sure you like, comment, and subscribe if you enjoy today's video topic. I make videos every single week for my therapists, how to grow in private practice, how to start a private practice, how to scale, how to market, everything you need to know as you are growing your career and building a sustainable therapist lifestyle. Quick disclaimer, this is general guidance. License requirements can vary state by state. I am here in Ohio, so the only state I can speak on is Ohio, and the only profession I can speak on in depth is the social work profession, which is the degree that I have and the profession that I practice in. Like I mentioned, I am a licensed clinical social worker, so we're going to start with the social work route. There are different routes you can take in order to become a licensed therapist. There are specific professions that can be licensed therapists, and I just want to make sure that we hit the main ones that are most known, and sometimes they're not known, so you can get an understanding of what it looks like to take on this career path. The social work route. So first, I went to go and get my bachelor's in social work, so my undergraduate degree. Then I progressed and I got my master's in social work. In Ohio, the independent route is licensed independent social worker. In many other states, it's licensed clinical social worker, but it's all the same term. It's all that independent level. I don't know why Ohio decided to be different. Obviously, I couldn't find any gear that said LISW because every state uses LCSW. That is another topic for another time. So I got my undergrad, I got my bachelor's in social work. And once I got my bachelor's in social work, I took the bachelor's level licensure test, which allowed me to practice in the profession and be licensed. It allowed me to do therapy under a supervisor. If you only have a bachelor's, you will always be underneath a supervisor practicing. I decided I wanted to do more. I wanted to practice independently. So I went to go and get my master's degree. The master's degree, you have to take the independent or the clinical license after you get your master's degree. And here in Ohio, after you have 2 years of supervision. So you go and get the bachelor's, you take the bachelor's test, you go and get your master's, you do 2 years of supervision and a certain amount of hours that comes attached to it. And then you can sit for that clinical or that independent exam. So I sat for my independent exam, passed. And then after that, I said, let's go full on. And I wanted to practice independently. So the job I was at, it came with a raise. And then after that, I said I wanted to open my own private practice. I know some states have more requirements once you become independently licensed to open your private practice, but Ohio does not. You just need that independent license and then you can practice on your own without the supervision of someone else. But again, if you get your bachelor's, you have to have that supervision of someone else. Let's talk about the pros and cons of getting your bachelor's versus your master's. So obviously, if you just decide to go with your bachelor's, the pros is less time, less money. But the cons would be you get paid less and you don't really have the ability to do more. If you want to get into these leadership positions and if you don't want to be supervised, you need to get your master's. And the good thing about it, if you have an undergraduate in social work, the master's degree, if you get accepted, which you should, is only a year. You can do the accelerated program. If you have a different degree undergrad, it's 2 years. But that's the good thing. If you want to go or you're going to get your bachelor's, you can just do the 1 year master's degree. The pros and cons of getting your master's, obviously the cons, more time, more money, more effort. But the pros is you get paid more and you have more opportunities, such as starting a private practice or working in those leadership positions and being able to supervise other people. Some people go to school and they never sit for their exam, and that's okay, but that's the route that they decided to take. I knew I wanted to do more with this degree. So if you didn't even know an exam is required, it is required. This may change later down the line. I know there's been a lot of discussion about it, but for right now, you do have to take those exams. And some states also have a master's level. So they'll have a bachelor's, a master's, and then the clinical. So you can decide, I think, between the master's and the clinical, but that if your state has that, just learn the different levels. Ohio just has the bachelor's and the independent levels. They don't have anything in between. Now let's continue just with the social work field in general. So yes, you can be a therapist. I know social work gets a lot of stigma. Oh, child protective services. That is not the only route you can take. Social work is so broad and the advocacy is so heavy that social workers are in different positions in different organizations and other professions are not. I really, really want to get rid of the stigma around social work because I never worked at child protective services, and no knock against anyone who has. It has its pros and its cons. But once I graduated, I went straight to hospital social work. I worked at a children's hospital and then I transitioned to the Department of Veterans Affairs, and now I'm at my private practice. There's so many different areas. You can be in politics, you can be in hospital, you can literally be anywhere. So if I get bored with being a therapist, I can transition my skills into a different field. And a lot of other professions, they only can really practice therapy because that's what their whole schooling was surrounded by. And that has its pros and cons too. Social work is so broad that we learn a bunch of different areas, and other profession schoolings is so narrow that they really get to hone in on one specific area. But in my degree path for my master's, I focused on that clinical therapy route. So mine was a little more drawn in as well. But that undergrad, it can be, you're learning so much and you're learning so many different things. Even if you focus on one path in grad school, doesn't mean that can't change as you get done with the grad school and you decide a certain profession. So that is the route of becoming a therapist with a social work degree. If I missed anything, just go ahead and leave a comment and I can answer it below. Let's move on to another profession. The next profession will be a widely known one, becoming a psychologist. And like I said, I have a degree in social work, so I can talk more in depth on that. These other ones, I'm just going to do a brief overview, but I want to put them on your radar so you can decide which path you want to do. Therapists and mental health professionals, if you're seeing clients every day and you're still Googling and going on Pinterest to find client worksheets, I have the perfect tool for you. For just 33 cents a day, you can get access to over 40 plus mental health workbooks. That's over 2,000 mental health worksheets, plus one new workbook every single week. These are not just random handouts. They're created by a therapist, trauma-informed, and ready to use. They're professional and tax deductible. If you're ready to take back your time, come join us over in the community, linked in the description. The psychologist route. From my understanding, just a psychologist undergrad degree is not enough. You must progress and you must either get your PsyD or your PhD in psychology in order to do therapy, practice independently, do all of these things with a psychology degree. And I think that's what transitioned me a little bit when I was getting my degree. But if that wasn't the case, I probably would have went full on psychology. I didn't know at that time if I wanted to get a doctorate and if I wanted to stay that long in school. Now I do want to go back and get my doctorate degree. If I was clear then, I probably would have went the route of psychology. But from my understanding, psychology, you must have these advanced degrees in order to practice therapy if you want to become a therapist. When you study psychology, they go deeper into the assessments and the testing, and in many professions, because normally within an organization, you have your social workers, you have your psychologists, and you maybe have your counselors, but the social workers and psychologists work hand in hand, and the role can overlap, but it can also be different as well. Psychologists, they really focus in on that testing. So that ADHD testing, autism testing, that is their expertise. And then it also depends on the different route they decide to go and what they decide to niche down on. But I really like that about psychology because you can, if you have an interest, you can go in depth on these clinical skills in a specific area. I would say psychology can be a little more narrow. Like I said, social work, it doesn't just have to be mental health. You can work in hospice. It's all these different fields if you don't want to do mental health. Psychology, mainly, it's around mental health. So it's just based off of your preference. Do you think that you may want to go a different route later on, or you want to stay on the same route? And of course, more schooling, but the schooling is required, the more schooling, right? Because they do go in depth when it comes to testing, assessment, etc. And with psychology, I'm sure there are similar requirements such as testing that goes based off of your degree, or that goes based off of if you're looking to practice independently, etc. Next, let's talk about a counseling degree. So counselors, LPC or LPCC, licensed professional counselor. This degree route focuses and draws in on counseling and therapy. This is a route that you can take. You can get your undergrad and then you can get your graduate degree, and you can do all of the clinical hours and the testing and exams. Just how I talked about in social work, the path is pretty similar with the exams and the clinical hours you have to get in the degree levels that you can be on in order to get that independence or that LPCC, because you must have a master's in order to practice independently and start your own private practice if the private practice route is something that you want to take. I would say with counseling, I speak to a lot of counselors, and a lot of them tell me, and someone may disagree, but a lot of them do tell me that they wish they would have went the social work route, or wish they would have got their master's in social work, because social work is so broad and counseling is pretty narrow, and just focus on the therapy piece or the counseling piece. Social work, like I said, you can work in hospice, you can work in politics, you can work in the hospital, you can work in a mental health facility. Counseling really just revolves around that counseling piece. But the two fields do overlap, the social work and counselors. The only thing is counselors have more of a strong therapy niche or background, and social work is a little more broad. So again, based off of your preference. Now we're going to go to the licensed marriage and family therapy route. I don't know much about LMFTs, but I know that they are still governed here in Ohio under the same boards of social work, counselors, and LMFTs. LMFTs is a route that you can go if you want to do therapy, and I'm sure they have similar license requirements, testings, etc. From my understanding, LMFTs focus more on that relational therapy, hence by the title, but they can do a lot of other therapy as well, and they do a lot of other different types of therapy. With becoming an LMFT, they have a specialized niche, and that means that they often hold a very competitive and strong job market. Now we're going to transition into the medical route. So we talked about the therapy side of things. Now let's focus on still mental health, but the medical route. So as we know, we have psychiatrists and we have psych nurse practitioners. If we are thinking therapy, these routes are probably not a route you want to take, but I do want to mention them. So we have psychiatrists. They are medical doctors. They focus on the medication or the medical side of things. It would probably be rare for you to find a psychiatrist that will prescribe you medication and also do weekly or bi-weekly therapy. They're normally seeing you once every 3 months or once every 6 months to monitor and manage that medication, and they refer you to a therapist. Now, do they have some training in therapy? Probably so, but that is not their focus. They are a medical doctor. So if you want to be a medical doctor, but you still want to do mental health and focus on mental health, the psychiatrist route may be the route to go. And you also have nurse practitioners, psych NPs. I worked with a lot of psych NPs. They also prescribe medication. It would probably be more common to see a psych NP do some type of therapy than a psychiatrist, but still psych NPs, they don't really get in and do the therapy. They mainly focus on prescribing medications, but they can often have a better rapport with their clients because they can spend more time, or they do spend more time. Because psychiatrists, I kind of think of it as a field. It's a very niche field, and it's not a lot of them, but it's a huge need for them. So they're seeing clients back to back to back to back to back, prescribing medication and trying to get a client on a good regimen, and they come far and few in between. The nurse practitioners are also able to pick up on the roles and be under a MD or under a provider, so they can get the training and all that they need from that provider and have some type of supervision. With these two professions, of course, it's a higher demand, 100%, and it's a higher pay. You're going to get paid more because you are on this like medical doctor side or on this prescribing medication side. So you're definitely going to get compensated more, but you also have to go through more schooling, rightfully so, to be able to prescribe these medications. The different ones that I went through, becoming a social worker, a counselor, a psychologist, a licensed marriage and family therapist, a psychiatrist, a nurse practitioner. Those are the main routes that you can focus on. Yes, are there other routes that maybe you can explore, but I am not going to go in depth on those. These are the core routes that you need to be looking at, or maybe you need to be focusing on. And if those other routes that I didn't talk about in this video may come up, they may be worth the research or worth looking into. Think about what you want long term as far as flexibility, specialty, lasting in this field, prescribing, not prescribing, and decide what route may be best for you. Talk to some other people who also may be in these professions so they can give you their honest opinion. But be sure to like, comment, and subscribe, and I'll see you guys on next week's video.